So then what happens if there's issues with billing? If you end up billing the wrong thing, or you end up billing too many of one procedure, or you're not putting the proper information forward, or you're not performing the service in an appropriate way, there is what's called the Billing Integrity Program, or the BIP, and this is a program which is a joint program with the Doctors of BC and the Medical Services Plan, and the Billing Integrity Program is there to ensure that doctors are being fair with their billings and that they're billing appropriately for the services that they provide. So this is assessed in a number of different ways. There are what are called service verification audits, which are letters that are sent out to your patients, and they'll be asked to fill out and comment on services that have been provided. Obviously, some patients forget exactly when the service was, so sometimes they end up calling your office, but generally the Billing Integrity Program will let you know if they're doing one of these surveys, and then they'll let you know the results. If there's issues that come up, they may send you a letter just for some clarification, and generally it's not too difficult to sort things out and to move forward. Other time where you may be asked to comment on your billings or your billing practices is as part of your mini practice profile that's sent to you every year from the Doctors of BC. It shows you what are your common billing codes that you use. It shows you how those compare to other doctors in your group. And if you look at that and it shows you that your billings for one particular code are way above what your colleagues are doing, then you need to think about that and figure out why. Are you using the appropriate billing codes? Are you using the wrong billing code for procedures that you're providing? So it's important to look at your mini practice profile and to sort out any discrepancies, because the Billing Integrity Program may very well be calling or sending you a note asking about what's going on. If you do find you're in the top 5% of billers for your particular section, then again, the Billing Integrity Program may be asking you to review things just to ensure that everything is appropriate, again, compared to your peers. So it's important to look at your Doctors of BC practice profile, or if you do get a letter from the Billing Integrity Program, it's important to provide them some information, because usually there's a good reason why things are different for your practice compared to others. If you have a special area of interest, or if you're used to using a certain fee code when another one should apply, usually that can get sorted out fairly easily. There's a few other terms that I think are worth trying to understand, and that's extra billing. So extra billing means billing over the listed amount, and this is only allowed for physicians who are not enrolled with the Medical Services Program, and only for services that are rendered outside of hospitals or health authority facilities. So if you decide you want to see patients outside of MSP and charge them privately, then that's fine, that's your business. But you can't be billing MSP and then billing extra to the patient just because you think you're providing an extended service or whatever the reason is. This is a bit different than what's called differential billing. So again, if as a specialist you get a patient that comes to see you and they haven't been referred by the family doctor, then sometimes you can look at getting extra money from the patient. So you may bill a GP fee code or a GP visit and then bill the patient for the extra difference if they haven't been referred appropriately. Again, ICBC and WCB both have different billing codes that they use depending on the situation. It's important to understand that, again, you should not be providing services to family members, and this is listed in the preamble as to what the definition of a family member is, and you should not be billing MSP for services you provide to family members. There are some non-insured services, cosmetic services we touched on earlier, circumcisions, lumps and bumps that are not medically significant, and other kinds of treatments that are not covered by the Medical Services Plan. So it's important to keep up with what's covered and what's not covered, and what things you can bill for privately. So remember, if there's private services or forms or other things that can be filled out, then you can charge your patients separately for those. And many physicians have a list of those hanging up in their office to inform patients. Just a few notes to remember is that as physicians, we're generally self-employed physicians, so you need to be responsible for your income and billing integrity, review your yearly profiles. If your medical office assistant is doing your billing for you, you need to ensure that they're doing it properly. You need to be keeping good records of what you're doing for your consultations, your follow-ups, and for your billings. And again, you should insist on being paid for all of the non-insured services that you do. It's important to follow up with your billings to learn how to adjudicate rejections so that they can be fixed and you can bill appropriately the next time. I would just like to take a moment and acknowledge Dr. David Braben, who's taught this course through the International Medical Program for some time. And I would also like to thank the reviewers, Dr. Tracy Scott, Dr. Jeffrey Ainsworth, and Dr. Roland Orfali for reviewing the slides. Thank you very much for your time, and if there's ongoing questions, I'd be more than happy to review them. Here's my email, but also if there's ongoing questions, don't hesitate to email your section because they will generally be able to provide you with the answers. Here's a few resources that are available for the Specialist Services Committee, Doctors of BC, and the different government websites you can check, and some phone numbers you can call if there's questions. And as mentioned, I would encourage you to contact the Doctors of BC or specifically your section for specific follow-up questions. I hope this gives you a bit of an idea about how to move forward, and good luck with your practice here in BC.